Live from Hollywood, this is the KTLA Morning News.
And getting lean like Shaq. Yeah, what are you doing?
I know you're wondering. Come on over here so you can see what's. Don't be scared. Come on.
I don't want to come any closer.
Look at this. This is unbelievable. Our Fitness Friday has brought us to Global Cardio Care. No, we're not resting. That's Cliff Winston of KTLA Radio 102.3, the home team. That's Helen Bradley, a patient from Los Angeles. And what we are experiencing is something called enhanced external counterpulsation. Don't laugh. This could save your life. We'll explain when we come back. Boy, this is like a man hugging you. I like this.
Fitness Friday, Gail Anderson, about to ruin your plans to eat your way through the holiday weekend.
Improving life one heartbeat at a time. I'm reading the brochure that Gail left. She's at a very unique facility in Inglewood. Now, we're a little curious about it because it looks weird.
It looks really strange.
Yes, very strange, and I'm glad you got the brochure. We're at Global Cardio Care in Inglewood. We're with Sara Soulati, because what you're looking at is something that quite a few celebrities have tried. Let me give you an example. Let me show you this. Shaquille O'Neal. Now, this is Shaquille when he was playing for the Lakers. You know, he's a little on the chunky side and whatnot. And apparently he got some treatments here in addition to doing some other things. And you see him here with the Miami Heat, leaned out. I don't know if you saw that, but a lot leaner, because Sara Soulati of Global Cardio Care, he did this. What is it that we're doing here?
The name of treatment is called Enhanced External Counterpulsation. It's an FDA-approved treatment. It's been around since the 1960s. It was invented in Harvard, but it's been FDA-approved since 1995. And what you're actually seeing are blood pressure cuffs that are wrapped around the calves, the thighs, and buttocks. And that pulsing that you're hearing, it's actually timed to the rhythm of the heartbeat. So when the heart is at rest, these blood pressure cuffs squeeze from the calves, the thighs, and buttocks and move all the blood from the lower extremities, and it pumps it throughout the whole entire body, helping with lowering blood pressure, people that have blockages in the artery. But Shaquille came in here because it increases your circulation. It gives you the ability to exercise for a longer period of time without having any discomfort. It removes lactic acid out of your leg. It really becomes a passive cardiovascular workout because for the first time your heart gets to rest. So it's a great treatment.
All right. Well, because I wanted Sara to explain it because it's peculiar. Now, let us show you what she's been able to do with other patients. We're going to put some information on the screen. This is Helen Bradley's information. I'm sorry we got your age on the screen, Helen, but you know how the medical people are. Obesity was a problem. Her weight was 346, blood pressure 118/80, heart rate 80. And you've been able to do what, Sara?
Well, you know, Helen came here about 2 years ago. She's lost about 100 pounds. Her blood pressure improved. Her heart rate improved. When she first came to us, she was only able to walk for about 10 to 15 minutes. Now she works out for an hour and a half without having to be on a diet, without having to do surgery. She lost the weight naturally without having to do any risky procedures.
All right, let me ask you a question of Helen. Helen, were you skeptical? Because I know people at home, I'm skeptical as to how this works.
You know, I was at the beginning, but when I first started, I love coming. I really love coming. It's helped me. My energy is so much better. And the energy in my legs, I mean, the way I can exercise now is 100% better than when I started.
Hey, Gailey.
So I was skeptical at first, but I'm sold on this.
I'm sure you guys have some questions. I wanted to show you. We got Cliff Winston of KTLA Radio over here. We'll talk to him more next hour.
Okay.
But apparently, Sara, Cliff has done the whole treatment route here. Is that right?
Yes, he's done 35 hours with us, 1 hour a day, 5 days a week for 35 days.
All right, now you guys have questions. Go ahead. Maybe we can get one.
No,
So we have to get out of here for next hour, but next hour I want you to tell us what that thing feels like. It looks so strange. I want to know what it feels like. We can get to that next hour, but, you know, there we go.
Very interesting. Lots of questions. Mark's already marinating on some to ask, I can tell.
But first, getting fit like Shaq, Gailey.
What you're looking at is something called EECP. It's Enhanced External Counterpulsation, available at a place called Global Cardio Care. Does this hurt? What does this feel like? What does it cost? What does it do? You'll find out when we come back.
Gail Anderson's got that special ability to make your heart go pitter-patter, especially today.
Could you can't take the charm, can you, Gail? Gail is in Inglewood, and she's going to show us a unique place for one-of-a-kind cardio workout, but you don't really break a sweat, do you?
No, and it's very interesting. We want to show you a bunch of things that are going on here. What you're looking at right now is the lobby of Global Cardio Care in Inglewood, because they've got free screenings. We got so caught up on the testing that we forgot to tell you about, there it is, about the other things that are going on here today. Free screenings for blood pressure, glucose, the whole Magilla. And then when you come inside, this is the wild thing that makes everybody wonder what is going on. Sara Soulati, this is called, I'm reading from their brochure, Michaela, you have a copy, the Enhanced External Counterpulsation System here. Cliff Winston with KTLA Radio is here because you've done this.
I'm just enjoying watching you pulsate.
But this does have a benefit, doesn't it?
Absolutely. Anybody that wants to improve their high blood pressure, people that have high cholesterol, want to improve their cardiovascular fitness without surgery, without medication. It's 100% safe. It's FDA approved. It's covered by all insurances and Medicare. And you don't need to wait until something happens. You can come down today and get free screenings.
All right, and we want to show you an example of the preventive medicine that this is used for. Here on the screen is information about one of Sara's patients. This is Lily's information. Well, there's Shaq. Apparently, Shaquille O'Neal is one of many celebrities who've done this, who's lost some weight, and you see him lean and mean with the Miami Heat now. Now, look at this information for Lily. This is one of your patients. Tell them what happened with Lily.
Well, as you can see, Lily came in with a blood glucose level of 124, and she ended up at 72. Her weight was 212, and she ended up at 205. Look at her blood pressure, 168 over 88, and now it's 128. She had 17% of her heart wasn't getting blood flow, and now she's at 100%. So this is a person that would normally get angioplasty and ended up doing EECP, and she never needed surgery, and her heart is back 100%.
Wow. That's incredible.
This
All
may
right,
seem
now you
really
guys-
pedestrian, Gail, but what does it feel like?
It feels like you're being, let's take some of your questions. Cliff, you can attest to this. It just feels like you're being squeezed, right?
It feels like you're being squeezed, and you can feel the blood. I mean, you can actually feel the energy. The energy level goes up. And they say improving life one heartbeat at a time. That's their slogan. I want to add something to that. Improving life one heartbeat at a time. Who's your daddy?
Here's a question. I got a question now.
Go away. Yes, go ahead.
Okay, now my question is, you remember back in the old days, they came up with all of these old-fashioned kind of fat jigglers. They had that thing that would go around your waist.
Yeah.
This reminds me of some of that. Do you have to really combat people's skepticism when you teach them about a new process
There's
like
the
this?
one, too, that you can do 5,000 sit-ups in 1 hour by adding the attaching
The
these
electrodes,
pods.
Well, you know, this was invented in Harvard in the 60s before bypass surgery and before angioplasty. And so this was a device that was used to save the blood, to get the blood up to the heart. So it's a very safe treatment, and I know it looks crazy, but it works, and it's effective, and it's definitely better than having your bypass procedure.
Absolutely. Can't fight that.
All right, let's just give you some information again. This
Real
is where
quick.
we are, Global Cardio Care in Inglewood. And we've been here with the folks from KTLH Radio. We want to thank them for letting us interrupt. We had a doctor here to, if you had any questions for him, but apparently the doctors, Dr. Frank Murphy says this works. So
All right.
here we are.
We'll take that.
Good deal.
All right.
Thank you very
All
much,
right.
Gail.
Thanks, Gail. Always bringing us interesting things.
I love it.